The broadcast is now starting. All attendees are in listen-only mode.
Hello, everyone, and welcome to the webinar on adherence and transition considerations hosted by the Children's Cardiomyopathy Foundation and Transplant Families. We are glad that you're joining us this afternoon and hope that the presentation is helpful and informative. My name is Gina Petty, and I am the Director of Family Support and Outreach at the Children's Cardiomyopathy Foundation. If this is your first time joining us for a webinar, welcome. We're glad that you're here. If you've joined us in the past, welcome back for today's session. Before we turn the presentation over to our guest presenter, Dr. Shellmer, we have just a few housekeeping notes before we start. If at any point during the presentation you need technical assistance, please type your question or concern in the chat window. If you have audio issues, you should be able to switch between using your computer speakers and your phone if needed. In order to provide a high-quality session today and avoid background noise, all attendees are in listen-only mode. Questions are encouraged and welcome during the presentation. Questions can be submitted via the question box, which is located on your control panel. We will be taking questions during the last 10 or 15 minutes of the presentation, so please submit your questions as you think of them, and then we'll address them at the conclusion of the talk. We will also be recording today's webinar, so you'll be able to access the information again at a later date. I'd like to take a moment now to introduce Melissa McQueen, who is the founder and president of Transplant Families. This week, April 23rd to 27th, is National Pediatric Transplant Week. In support of the week, CCF worked together with Transplant Families to offer 2 educational webinars, as well as other awareness initiatives. We're thrilled to be collaborating with Transplant Families on this project. Welcome, Melissa.
Hi, Gina, and thank you so much for the introduction. Transplant Families was founded in the hope to support, educate, and inspire pediatric transplant families for all solid organ and bone marrow transplants. We are so happy to celebrate National Pediatric Transplant Week in collaboration with Children's Cardiomyopathy Foundation. Proud to work with CCF and all the support organizations, hospitals, medical professionals, and many others that make pediatric transplant a much easier journey. Every day after transplant is truly a gift to us, and we thank you for that. It is now my privilege to introduce Dr. Shellmer, who is supervising psychologist for the Transplant Psychology Service at the Children's Hospital of Pittsburgh of UPMC, and associate professor in Department of Surgery at the University of Pittsburgh School of Medicine, and a National Institute of Health funded researcher. She established a Transplant Psychology Service at CHP in 2006 and has since developed the services provided to patients and families over the past 12 years. Dr. Shellmer works with heart, lung, liver, intestine, and kidney pediatric transplant patients and their families. She has been within the field of pediatric transplantation since 2003 and has worked with children with chronic medical conditions since 1999. Dr. Shellmer specializes in treatment of non-adherence and adjustment to illness and provides guidance and support in getting adolescent and young adult patients ready to transition to adult care. Dr. Shellmer's research interests mirror her clinical care, focusing on examining ways to promote adherence, assess and enhance psychosocial functioning and adjustment prior to and following solid organ transplantation, and assessing factors that affect transition to adult care. Dr. Shellmer has published various articles related to psychosocial functioning and adherence, including articles on the use of mHealth technology and promotion of adherence. Dr. Shellmer has also acted as consultant to the UNOS Patient Affairs Committee and served on the editorial board of the Pediatric Transplantation and the official journal of the International Pediatric Transplant Association. Dr. Shellmer, welcome and thank you for joining us today.
Thank you, Melissa and Gina. I very much appreciate the opportunity to speak today. I hope that people will find this helpful and that they, if they have questions regarding the information being presented or other questions, things that I may not touch upon, that they feel comfortable in submitting their questions. And if I'm able to provide some guidance, I would be happy to do so. So my intent today is to talk somewhat regarding adherence and transition. These two things are closely linked together, particularly in adolescent transplant groups, but also in chronic illness across the board for children, adolescents, and young adults. truthfully, adherence is a very thorny topic. It's difficult to sort of wrap your mind around the best ways to really help every single patient and provide the type of scaffolding and support that they need as they not only sort of grow into young adults and eventually, fully grown adults, but also as they handle the typical developmental process and all the other factors that go into it. So let me start with, I hope everybody can see it. It's sort of cut off on my screen, but I hope everybody can see what it says. Adherence in itself, the reason I call it adherence and not compliance is because compliance suggests that someone else is sort of setting the mandates in regards to what medical care should be. Adherence is considered more of an interactive process where you work with your provider in order to make decisions regarding your healthcare. But it's also considered sort of something in degrees. So it's not 100% or zero. It's the amount of effort really put towards taking medications, making changes to your lifestyle, following a diet, and deciding with your provider what the recommendations are going to be followed. Now, that is something that's significantly easier to do when it's an adult negotiating what they're willing and not willing to do with a medical provider. However, when you're talking about a child who may enter the healthcare system at birth or at another point in time where they're still developing, the negotiation really becomes more triangulated because now you're talking about parents doing their absolute best in order to look out for the well-being of their child, but entering into a sort of contract with the medical establishment in order to decide the appropriate care for their child. And their child later on in time sort of inheriting that agreed upon treatment plan. When we look at what really consists adherence or good adherence, it's sort of that space where patients are doing enough that it doesn't have a negative impact on their outcomes. So there's no sort of how is that interaction managed and how well are they adhering to things may vary over time and is not consistent, sometimes not even day to day. As I was mentioning, adherence in pediatrics is more familial. You're entering into it with your parents, sort of setting the stage for what you will be doing later on. And as children become older, as they begin to understand what is required of them, then they can be more active advocates for themselves and also more active in sort of their interactions with the medical team in regards to what they are willing and unwilling to do. However, that takes time and it takes understanding and it takes sort of reasoning, understanding the reasoning behind the treatments. And some of the treatments that unfortunately we prescribe as part of medical care are not that appealing and can be uncomfortable. And so for a young child in particular, they may not be able to link the idea of I will feel better if I do this when it's right now making me feel worse. So it can become a struggle if over time that child has difficulty in sort of grasping the reasons behind our decision making from the medical arena. Why are we asking you to go and draw labs so often? Why are we asking you to come in for biopsies or other procedures? And if they experience it in a negative fashion, it can become difficult for them to accept even future suggestions for care, even if things are not intrusive, like ultrasounds or EKGs. They may already be sort of preset for not feeling so great about the process. As a result, there's a lot of non-adherence that happens. There's non-adherence in children and adolescents, and it varies depending on the type of condition that you're looking at. But in pediatrics in general, it's around 50%. So any chronic illness, basically, that a child may experience, up to 50% of the chronically ill population may not take their medication, or not well enough for it to function the way it should. Or they may not follow diet recommendations or really come for clinic appointments. In pediatric transplantation per se, there's been various presentations and a lot of research on this, and the rates vary widely depending on how adherence is assessed and how what areas of adherence they're looking at. So if they're looking at medications versus they're looking at clinic visits versus they're looking at adherence to diet, it varies, but the ranges are up to 71%, which in transplant can be a significant problem because now you're looking at where does that lead, and that leads to rejection, potential need for another organ, or much worse, which is the death of a child or an adolescent. The highest incidence of non-adherence, so not actually complying, not engaging with the medical team and doing what is recommended, is in the adolescent group. And particularly in transplant with kidney transplant patients, that's where it has been reported to be the highest. And we found that non-adherence does increase over time, so that it is complicated by multiple issues, including the age of the child or adolescent, the developmental level, their level of psychosocial functioning. As you can imagine, if an adolescent doesn't fully grasp the reasons why they need to take their medications, they may be less willing to actually engage in the process. There's also, situations where families are struggling just to put food on the table. They're having, they don't have a lot of resources. They don't have perhaps other caregivers. Perhaps it's a single parent family, or it's a family where both caregivers have to work in an excessive amount of hours per week in order to just make ends meet. And so there's less availability for oversight, which makes it more challenging to make sure that your child has taken their medication, particularly if a child's more independent, is older, and you're relying on them to also do their part. And of course, there's other factors. Sometimes patients, thankfully, return to some level of normalcy following transplantation or are able to engage in other activities, but that introduces some level of complexity into an everyday schedule, making it more difficult, for example, if there's practice after school, or if they have to go to aftercare and they need to take medications. How easy is that to manage? How easy is that to make sure that the child or adolescent is able to take what they need to take? Non-adherence rates are also high in adults, which, when you're looking at the transition process, young adults are the ones most vulnerable for not being adherent. And rates in adults range up to 78%, which is even higher than for pediatrics, pediatric transplant in particular. So when you look at the adolescents or young adults who are transitioning from pediatric to adult care, you do see a significant drop in adherence for some of the patients who are not ready to transition. And there have been reports of up to 70% of 70% organ loss, particularly in kidney transplant patients when they transition from adolescent to adult care. And some of that may be sort of their loss of a relationship with their medical team. The new medical team may not know them as well, may be not as poised to provide them with sufficient support. It may be that in many cases, the adolescent or young adult's not quite ready to really take on all that responsibility. And of course, adult services are geared towards adult independent patients. So they are not necessarily engaging parents and trying to get patients to sort of adhere at the same level as a pediatric facility may. When you look at reports from patients in all areas of chronic illness for adults, 5 out of 6 patients report some level of non-adherence, and that may be something like the time. So they might still be taking the medication, but they may be taking it 3 or 4 hours later than they should. They may not adhere to the dose. They may forget to update how much they should be taking, and or they may forget how frequently they're supposed to take the medication. So they may take some medication per day, but they may miss the second dose, which again in organ transplantation is a significant problem. Um, what complicates adherence, and this is true for pediatrics and for adult care, is a feeling of self-efficacy, which is sort of feeling like you can do it, that you are able to take your medications, that you are able to follow your diet recommendations, that you are able to make those clinic appointments. And sometimes, even in adult patients, that they don't feel capable of doing this without some additional level of support from others in their lives and or from the medical team. It's also an issue of organization. So if your day changes and now you have something else to do or someone else to pick up or somewhere else to go, but you didn't prepare ahead of time or you didn't carry your medication with you, you're in a poor state in order to be able to actually stay on top of your medical care. And I mentioned earlier support, which is just your immediate support system, but also supports in other areas. So support in transportation, for example, being able to get to the clinic, being able to engage with your provider, having enough time for a discussion with your provider in regards to what may be your complications, what may you be experiencing. When you look at adherence sort of over time, for patients who are newly diagnosed or where treatment is initially initiated, you see that the greatest levels of adherence are within those first 6 months because a lot of what's happening is sort of recovery, a lot of intense monitoring from medical teams in order to make sure that patients are adjusting well to the medical regimen and also that the regimen is actually working. So there's greater points of contact, either through clinic visits or phone calls or having to report back regarding symptoms and alleviation of symptoms, which may not be the case later on. So you see patients really staying on top of things within those first 6 months. And also right before clinic visits. So a lot of times we may forget, you may see patients forget to take medications a lot in between, but they know a clinic visit is coming and they may restart taking their medications in order to be able to report to their provider that they have been taking medication. Also easier, less complicated regimens are obviously easier to follow. And so there's less of a likelihood of individuals sort of missing medications because it's too complex. But for some transplant patients, at times, particularly the initial period following transplantation can be quite complex, actually. They can have 3-4 different dosing times during the day, and that can really throw a wrench in the ability of a family to really stay on top of things, particularly if you have a family that has multiple children who has multiple requirements on their time, and it does create some difficulty there. And when you see higher provider monitoring, so more contact with the medical team creates better adherence. Now, where the lowest adherence happens is obviously in chronic illness, which is the groups that we're engaging with today. Unfortunately, when you have something that you have to do every single day, it does become more tedious and it becomes more difficult to truly manage and do all the time, simply because life gets in the way many times. And also sometimes in teenagers in particular, they may not be that interested in their medical care, or they may forget, or they may not have the organizational skills to really follow through. With greater complexity, again, the regimen may cause increased difficulty in helping someone stay adherent, and the less contact. So the farther out you go from clinic visits, when you're looking at a yearly clinic visit, sometimes that's too far for a patient to really actively remember and take all their medications consistently. So what factors can help improve adherence? Unfortunately, there haven't been a high number of interventions, particularly in pediatric transplantation. That's an area that is evolving and growing, and I myself have studied somewhat of mHealth technology in order to promote adherence, sort of reminders and texting and other factors that may be helpful, particularly for teenagers who are very well versed in use of technology nowadays and very comfortable with it, it might be a way to enhance their adherence. But there's multiple areas, including the skill level of the patient, the developmental level of the patient, their cognitive functioning, the support systems that are available to them, the type of provider or the type of environment that the provider is in, and the level of support that they themselves can provide, and the medical system in general. Sort of where is this patient embedded? Those are all sort of interact in regards to potentially improving adherence. I'm going to sort of now discuss somewhat transition, which for many medical groups, unfortunately, transitions is more of a transfer. So patients reach a certain age, or there's a certain place where they reach from the medical care, and they're sent over to adult treatment. And transition is not exactly that. Transition is a progression. It's something that should be planned, that is specific, that should be discussed with not only the patient but also the family in the best way to support the family in doing this effectively. And it really should happen over the course of years. I know that sounds potentially could sound like it's excessive, but the truth is that we prepare our children for multiple things starting at birth. We prepare them to go to school for a long time before they actually enter school. They are then in school for a very long time before they reach the working world. And along with all of that, we also prepare them for daily life, for peer relationships, for romantic relationships, for all kinds of things, as we're getting them, sort of helping them launch into adulthood. The same thing should happen with their medical care so that they feel ready and able to sort of take on this responsibility. When we're teaching our children even very practical skills, such as driving, we take our time, we put them sometimes through courses, we have instructors, we have all kinds of things in order to get them ready to go out on the road behind the wheel, which is exactly what we should do, because we should be making sure that they're safe. The same thing should happen when we're looking at their medical needs. So the influences on transition are various, and they kind of mirror everything that we talked with adherence. There's the patient level factors that affect how the adolescent and young adult will sort of adapt to the idea of moving on to a different set of providers potentially at a different location, in order to continue their care. There's the family level factors. From this end of things, sometimes we do see that parents have a little bit of a difficulty letting go of the pediatric team, and we understand that. We've formed a long-term relationship with families. We have seen their child grow and develop, and it is hard. It's sort of leaving if you've had a good relationship with your team and you feel comfortable with your team, it is sort of like leaving a family behind, and that can be difficult. There's also community level factors, sort of what are your choices? Where can you get support if your child's now an adult? What are the supports that they can have? What is the community sort of discussion around healthcare? For some populations, for some minority populations, there's some distrust in the medical community, and there's a feeling that maybe there's not enough access to care and easy access to care. So what is affecting that? And of course, is the healthcare system factors. Is the healthcare system set up in a way that it does support sort of this transition, that they do provide perhaps additional monitoring for those young adults who are entering their system and who may still need to get sort of used to the idea of being in an adult setting? Do they provide perhaps young adult clinics where young adults can feel more comfortable? Some young adults do not like attending services in an adult facility simply because they feel that they don't belong there. The majority of the patients in the waiting room could be much older than them, and they may feel uncomfortable in that situation. And for the adolescent themselves, what factors affect their readiness? So are they feeling adjusted to this idea? Are they feeling adjusted in their general life? Are they able to manage their care? Have they had the opportunity, for example, to learn to order their own medications from the pharmacy? Have they had the opportunity to fill out their pill box independently without parents doing it for them? Are they able to do that with monitoring initially, of course, with parents supervising and making sure that it was done correctly once they're done? But are they able to do that? Do they know how to make a clinic appointment? Do they know how to, for example, schedule a procedure if they need one, schedule a biopsy, and maybe if they are now transitioning into young adulthood and maybe will be getting a job soon, can they manage the relationship with their employer so they can take time off in order to go to the clinic appointment without necessarily a parent sort of managing that for them? Also, the knowledge of their regimen and what it requires. Are they able to remember, for example, for that procedure that they were able to schedule? Do they remember to hold their medications? Do they remember that perhaps they need to take a prep med before they go in? And the ability to do so independently. Um, as we're getting our children ready to move over to adult care, it's also around the same time as many of those children will either be transitioning out of high school or a formal education in this country, and or they may be transitioning on to college and perhaps into the workforce. So all these are major transitions for a lot of adolescents and young adults. And if they're all happening at the same time without a lot of pre-planning, it could become overwhelming. Imagine an adolescent who has now moved, maybe, cognitively they're intact and they have been able to get into college, they're doing a program of study, they've gone far away from their families, and now they're learning their medical care independently. That would cause a lot of anxiety for the adolescent and probably the family also, in regards to how comfortable do they feel with this adolescent going far away. And that sort of hints at the challenges. What are the challenges to transition? So for adolescents who are transitioning to adult care, as we have learned over the last few years in my field and in other fields, neurology, neuropsychology, psychiatry, development and growth, the brain is not done growing until your mid-20s, basically. Your frontal lobe, which is the area of your brain which organizes information, which helps you sort of structure your world around you and allows you to really form connections in regards to how things should be working and falling together, is not done pruning and sort of setting until your mid-20s, which creates some difficulty when you're looking at that particular area, relying on that area in order to make decisions that support your care and also support your everyday life. So some of the risk-taking behaviors, some of the poor planning behaviors that we do see in adolescents are to some extent related to the fact that they're not done with their development. There's a wide variety in children and adolescents and young adults in regards to how mature they may be. And we have to be aware of that as we are making decisions as healthcare professionals, but also as parents in regards to what is the right age, what is the right approach, what is the right way to guide our kids as they move from one care system to another. Adolescents are also increasing or want to increase in separation from their parents, which is really quite difficult when you're managing a chronic medical condition. You do need oversight from a parent. You do need some level of supervision in order to make sure that your adolescent or young adult is actually following through with medical recommendations. But at the same time, this is the time when they want to separate from you, that they want to make their sort of stake their place in the world. And so managing that fine line between allowing them the room to make mistakes and yet not make a mistake that's going to harm them from a medical perspective is challenging. Adolescents tend to have a perception of being vulnerable. Now, this is different for children who have been living with chronic illness for a very long time. But we also see a lot of patients who have been typically developing and have and have an acute, like in a unexpected presentation of illness. And so they have been developing well and there have been no issues, and all of a sudden they become ill. And this is particularly difficult for those adolescents to sort of wrap their minds around, that after a transplant, they're not back to exactly where they were before. And it's hard at times for them to adjust to the idea that now they have to do medical care and they have to adhere to medical recommendations because they have never had to do it before. And it makes it challenging for them. It's also a time when a lot of kids do this sort of risky things. They begin to experiment with alcohol or drugs, or they may engage in sexual activity, all of which, when you have a chronic medical condition, may affect you in different ways. It may affect your ability to really absorb your medications, may affect your ability to process the medications that you're given, or to, for there to be interactions with potential medications. It also makes it difficult sometimes for some of these adolescents when they have, for example, diet restrictions. And maybe the majority of their friends, or if they do have a peer group that they spend time with, a lot of our social interactions at that age and even later in life, throughout our lives, are around food. And that in itself can become a challenge. As I mentioned, the typical timing of transition sort of also coincides with all these sort of developmental challenges. But in addition to that, it tends to also coincide with the top end of the survival for some of the transplanted grafts, particularly for those adolescents who were transplanted as infants or young children. And so you're seeing not only that they are sort of developing as adults, but sort of the graft is also coming to potentially an end and requiring retransplantation, or potentially requiring an increase in medical intervention, which makes the whole process somewhat tricky. When you look at survival rates, for example, for 11 to 17-year-olds in particular, so these are kids who have been transplanted during this age range. When you look at the first year of survival post-transplantation for all the various groups, so heart, lung, heart, intestine, kidney, liver, and lung, you're looking at over 80% survival. You're looking at actually really good survival rates for this age range. However, when you look 5 years later, you can see a significant decrease in survival for these patients. So 5 years post-transplantation, 11 to 17-year-olds who have undergone transplant within that age range are not surviving as well. And some of these factors are obviously biological and medical. Intestine and lung transplantation are challenging, and they are still an evolving, very evolving science. But when you look at heart, kidney, and liver transplant that are much better established and have been around for a longer period of time, you're also looking at potential non-adherence as an issue and a reason why the transplant itself has not done well, and perhaps why patients may need retransplantation and or support. When you look at chronically ill patients and patients who require transplantation, you also have to take into account the other factors of their development that may be affected by their medical condition. So children with chronic medical illnesses do tend to have poor performance in regards to cognitive tests. It's not across the board. There are some medical conditions that are harder in regards to cognitive functioning than others. Heart conditions are particularly difficult, especially those that create an oxygenation issue for patients. Heart-lung transplant patients are also affected by this. When you see intestinal transplant patients, for example, the nutritional aspects that have precluded them from having good growth and development from a physical perspective can often also affect their cognitive development. Cognitive ability can be compromised and can be, 10 to 15 points below what the general population may have, particularly in some of these populations. And there's higher rates of low scores. So even though the scores may be at the lower end of the normal range, when you look at a cognitive score, you look at what an average is 100. And when you look at the scores and how they sort of spread over the population of kids who have these types of chronic medical conditions, you see that a lot of these kids have sort of, they're within average, but they're at the low end of average. That creates some pockets of deficits, which I will discuss in a minute. There's concerns in regards to short-term memory, for example, how quickly they process information. So you can imagine that a adolescent that comes into a medical appointment but may have some issues in remembering, so putting information to short-term memory, which is then how we transfer it to long-term memory so that we can actually keep it in there and then recall it, which is a whole other set of skills, and how quickly we process that information can be affected. And so if a provider comes in who maybe assumes a certain level of understanding for this particular patient and just goes over, changes, and walks out, that adolescent or young adult may be lost, may not have really fully understood the information that they were provided, even though they wanted to engage and understand. So here are some examples of how it can map on to the concerns. For example, if a child has an expressive language issue, which can happen, they may have difficulty in really communicating well with the medical team and like being able to ask questions when they need to, in being able to really put their point across and state that I've been trying to take this medication, but I cannot do it well enough, and it's giving me complications, and I'm having this kind of an issue. They may find that very, very difficult. And so learning skills such as writing down what they want to say or making sure that they have a support person with them, even when they transition to adult care, who can help them remember some of what they want to discuss, is vital. Attention. So a lot of the kids, unfortunately, even those that are seemingly very well, some of the immunosuppressant medications can cause a little bit of inattention, can sort of create a foggy sort of cognitive state. And as a result, you see them maybe going in and out of attention, both at school, but also in regards to their medical care. So they may have good intentions to maybe take their medications, but they get distracted and they forget, or they forget what it was that the provider was discussing with them, and therefore they don't write it down and they don't remember to change a dose, for example. Short-term memory issues, again, remembering medical information or taking the information in as it's being provided by the medical team. So maybe they are taking it in, but they're slower than it's being presented. And as a result, at the end of the session, they've taken in part of it, but not all of it. And so they could have missed something very, very important. Visual spatial functioning, although you would think with medical care, it may not be a big deal. It could be a huge deal for a young adult who is trying to learn a brand new medical facility. They may get lost easily. They may not know how to find the radiology department and give up if they get frustrated. So there's a lot of factors that can affect this. And fine motor skills can also be affected. So opening bottles or writing down information or entering information, sometimes prograph, which is often used with solid organ transplant patients, can create some level of shaking. And some patients never get used to the medication enough that they stop shaking, and it affects their ability to do certain things. The cognitive area can also affect their academic functioning, which then has subsequent potential complications in regards to transition to adult care, because they may have some difficulty in finding work or, graduating from high school or going on to college. If they do go on to college, sort of what are the expectations there? So you see some difficulty when they've had a transplant in re-entering school and being able to pick up where they might have left off. A lot of kids are in cyber schooling or home schooling, which for some of them it's great. It really helps them stay on top of their academics. But for others, the sort of the criteria are not as stringent, and they may find that their education is affected, which then affects future sort of attainment levels. you may also see that they have issues with arithmetic or reading, which may even affect their ability to read a pharmacy bottle or read medical instructions that are handed out at the end of a visit if that's provided by their medical office. And for some kids, they're very well known within their community. They're very well known by their teachers. And although the teachers are trying to help them by giving them a break in their academics, sometimes the expectations are lowered, which can be okay if they're going through an exacerbation, but long term may have detrimental effects in regards to their overall academic attainment and therefore subsequent ability to effectively sort of meet all the needs of a young adult. In addition, because kids do experience significant concerns in regards to the medical care, you can see rates of depression, anxiety, sometimes PTSD symptoms with patients in regards to being more aware of sort of their health and undergoing some instances of what they could consider to be trauma. And that can affect not only their adherence currently in their pediatrics facility, but it can also affect their adherence to adult care because they may want to avoid additional instances of discomfort, additional instances of difficulties adjusting. If they have high levels of anxiety, it may be very hard for them to transition without a lot of support to an adult provider whom they don't know. It may also be very difficult to just walk into the building if they've experienced high levels of trauma as part of their care, whether in transplant or other medical factors. And the trauma may evidence itself in a variety of ways, including the typical PTSD fashion, which is sort of being hypervigilant, having fear in regards to future medical visits, or fearful of being in the building, being very emotionally reactive to providers, but it can also present itself in avoidance. So they may not want to go get labs. They may not want to go refill their prescriptions because it continuously reminds them of their medical care and their medical needs. In addition, some kids do experience some social functioning issues, which then again maps onto adherence and can map on to transition. So they may feel isolated. They may have fewer support systems. They may have concerns in regards to sort of the tasks of long-term development. And although there's not a lot of data out there in regards to some of these issues, but some chronically ill groups, and particularly some of the more affected groups of patients who do undergo solid organ transplantation, may have greater difficulty in being independent for cognitive, academic, and other reasons, living independently, perhaps being able to find a partner in their lives and being able to find consistent employment that would allow them to have greater sort of access to insurance, but also greater access to being able to take the time off when needed in order to care for themselves. Quality of life, again, can be affected depending on their experience. For example, some of our patients report higher levels of quality of life than their parents. And I think the disjoint between that is that some of these patients have never experienced anything different. So to them, it's not a bad situation. However, parents have a longer perspective and a wider perspective of what life could be like for their child, and therefore they may be able to see additional concerns in regards to the care. Some patients also experience some delays in sexual maturation. Stature is affected, particularly in kidney transplant patients, and that can lead to a variety of different factors, including difficulty in peer relationships, which can lead to some mood instability and self-esteem and self-perception issues. And the family itself is often affected significantly just because of the high level and burden of care. They can be caregiver burnout for some families where patients have been chronically ill for a long time, but there's not a lot of other support systems that are there to intervene and help. It can lead to depression, anxiety, and PTSD symptoms also for caregivers, particularly when they have been afraid for their life of their child and their survival. And that in itself can feed into sort of the relationship between the parent and the adolescent in being able to support them as they learn about their medical care in order to be adherent, in order to then learn the correct process for transition. I just to reiterate, adherence and medical management, there's a lot of issues that can be affected, and these are the factors that I have reviewed over the course of this presentation, which includes older age of the child, sort of how the family is functioning, and also the psychological status of the child. In addition to that, we talked about how more complex regimens make it more difficult, and how um, certain aspects of care are really not easy to follow through upon. So there's issues with medications, home monitoring, clinical lab, and diet restrictions as well. When you're looking at getting ready for transition, all of these factors interact with one another. So you have psychosocial functioning, cognitive functioning, and their effect on a multitude of factors. So effective self-management, knowledge of your medical needs, independent participation in medical care, all these things map on in whether a child or adolescent is, or an adolescent or young adult is truly ready to transition care. So what can we do in order to support our adolescents? And one of the things that we can do is start early. We can involve them in the process, in their own healthcare, in the medical management. We can talk to them in regards to what is needed. And also, as professionals, we can talk to family members in regards to potential limitations that their child may have. So if there's limitations from a social, cognitive, or physical perspective that we have identified throughout the course of their care and that we know may interfere with their ability to really truly be independent, we can discuss that with the family and strategize about ways in which we can help them make the transition more effective. And this requires that as providers and as parents, we think about this process in the long term. We think of it starting at the time that really our child starts to have care. How are we going to teach them in regards to their care? What is important for them to know at what stage of development, and how can we support them in knowing more? When you look at self-management, which is one of the cornerstones of being able to transition and being able to do so successfully, there's all these factors that affect it. And we have talked about it on multiple times because it affects adherence, but it also affects transition as a whole, but also it affects self-management, which is its own specific component. And when you look at it, if they're unable to really have the support of all these areas in order to then adhere to the factors that are in the middle and then have a positive outcome, it makes it much more challenging to effectively transition from a pediatric setting to an adult setting. Some of the current limitations specific to transplantation is that there's not a lot of data out there. A lot of pediatric transplant studies are limited in scope. Thankfully, there's a lot of children waiting for a transplant, but not as many as adults, and therefore the studies are smaller in number, and therefore generalizing some of the information can be difficult. We have to look at it from a more developmental perspective, and that perspective has not previously been consistently used across the spectrum with some of these chronic medical conditions. And most of the transition research has been carried out in very specific populations within transplants. So liver and kidney transplant patients is more common because those are larger populations typically who have undergone transplantation. There's also a very limited number of studies that have assessed risk-taking behavior. So when I mentioned briefly alcohol use, drug use, sexual activity, things of that nature, there's not a lot of data out there for adolescents. There is a lot of data out there for adults on how that maps on to the overall outcomes. And we can borrow from that, but it's a different situation when you come to transplant as an adult or you start a chronic medical condition as an adult, that when you have dealt with one from as long as you can remember. And lastly, because transplant is an evolving science, every year survival tends to increase, which is fantastic. But at the same time, it does leave us with another gap in what we know in regards to sort of the long-term perspective of how these children will develop and their eventual outcome on the other side once they have transitioned to adult care. And that's the sort of the end of the presentation. I'm happy to take questions if there are any.
Thank you. Excuse me. Thank you so much, Dr. Shellmer. That was a really informative presentation and very, very, very useful information. We appreciate it very much. Thank you. I'm going to invite everyone now to submit any questions if you have them. There's currently no questions in the queue, so if you have any questions, feel free to submit it now for in a few minutes, and then if not, we'll wrap up. Okay. Okay. Well, thank you again, Dr. Shellmer. We don't have any questions. Oh, wait, hang on one second. Somebody is submitting one. Sorry, it's coming. Okay, they're starting to come in now. Do you have any suggestions for any apps for the teens to use on their phones that would be helpful in their use with compliance and adherence?
Yes, there's some nice apps out there. I think one of them is Medi Apps, I believe it's called. I can certainly send you a list of some of the ones that have been used. They're commercially available. You can get them through, the Apple Store or Google Play Store. There's some nice apps in for actually if any of the patients also need insulin. And they have diabetes. There's some diabetes apps that are very nice, and then there's some medication apps that do provide support. I would suggest one that, because I did my research in sort of a dual app that I developed, but it's not commercially available because we're still testing it. And I would suggest one that does give the parents some feedback in regards to whether the child or adolescent has taken their meds, because that helps provide sort of like a secondary level of support for the kids. And I will send the information because I apologize, but I can't recall off the top of my head what it's called, and I don't want to send you in the wrong direction.
No, that would be great if you could forward that, and then we can send that out to the group. That would be wonderful. Thank you. Another question is, what resources do you suggest for assisting with adherence? Are there particular websites or books that you would suggest?
For adherence, well, there are some websites actually through the various foundations. So I know, for example, the National Kidney Foundation has a lot of patient education that is available online, and it can help kids sort of learn about the importance of the diet restrictions and exercise recommendations, and also some of their medications. And that in itself can provide sort of a baseline level of information that the kids can sort of acknowledge and understand why they need to do certain things. Different foundations have these resources, and I would explore, like our hospital. I'm at the Children's Hospital of Pittsburgh. We do have links through our website, for example, for the various transplant groups, and then we have information linked to that. And that can provide them with additional information. One thing that is very practical that I would say is I know it can be a pain at times, but having a pill box is very important. Setting alarms on your phone independent of an app can be very important. And then working with your medical team with resources in regards to learning about the medicines and what they do and why they work together. It's also very important. These are things that, unfortunately, in transplant itself is an evolving process. Um, if you The Children's Hospital in Toronto had a lot of resources online actually that could be accessed. That it was called Passport, and it provided a lot of resources in regards to what you can do, what you can learn, and taking medications.
Okay, thank you. And I would also just like to add that at the Children's Cardiomyopathy Foundation, we also have a resource booklet that's transition to to adult care for families to assist them with their transition to an adult cardiologist. So if that's something that anyone is interested in, we can certainly share that as well. Okay, there's some more questions coming in, so we'll do our best to get through them within the few minutes that we have left. There's a few questions here around support groups. Do you recommend any support groups for adolescents that would provide peer support? And what would your suggestions be?
So again, I think that's somewhat sort of personal sort of situation. Some hospitals, our hospital being one of them, do have like adolescent support groups that are open to to all solid organ groups. And I think if your hospital has availability for that, that would be great. I do think that there are some Facebook groups that provide support, but I really don't want to endorse any particular one. I would encourage you to explore them and see what is available and what you're comfortable with, because there's also levels of disclosure and amounts of information that are shared that you may or may not be comfortable with as a parent, and depending on the developmental age of your child. And so I would encourage you to be sort of very information seeking in that regard, and really determine what you would want your child to be exposed to and wants to know, depending on how you feel they can handle it. Your hospital is your best resource, I would say. Most hospitals do have some level of support groups or adolescent groups, particularly through adolescent medicine, if that's available through your local hospital. And they have support groups in regards to chronic illness and other factors.
Thank you. And then there's another question here specific to heart families about transplant services for adolescents. And so I would just like to chime in on behalf of that one with regards to Children's Cardiomyopathy Foundation. We do have a variety of youth programs, including a matching program. We have youth and teen ambassadors that can be connected with adolescents for support. And then we also, as you mentioned, we also have some online forums as well. So so feel free to reach out to me. And if you're joining us from another organ-specific group, I would suggest reaching out to them to see if they have similar programming available as well. Okay, let's see if we can get through a few more questions here. At what age would you recommend children start participating in their medication, like filling the pill case and ordering their refills? Is there a particular age?
So those are, I consider those two separate developmental tasks due to their age. So filling out the pill box, you can start as early as 6. And they can identify their pills through what they look like. And you can teach them the names and do that together as a parent-child sort of activity. We're going to do this every Sunday if you so choose. And you can use that in order to also teach them about what they do. So you can, every week you can decide on a different medication to talk about and say, do you remember the name of this one and why do you need it? And eventually, teach them what it does for their body. And you can change the amount of information you provide them in regards to their meds as they get older and they understand more. so that they continue to have that habit. When it comes to actually ordering, I think that's a higher level skill. So I would probably not do that before they're teenagers, before they're about maybe a tween, maybe 12, 13, but I would wait for that in the event that they come across an issue. If it's as simple as just sort of calling it in, it's fine. If it's more complicated, for example, that they do have to go through their insurance company or they have to go through ordering process because it's more complicated than just medication. They're ordering, for example, TPN or they're ordering something else, then I would recommend they're an older adolescent around 16 years of age.
Okay, great. Thank you. In the interest of time, where we are just about at the hour, so if you've submitted any question that hasn't been answered yet, Dr. Shellmer has graciously agreed to comment on the remaining questions offline. So I will forward those to you, Dr. Shellmer, and I will redistribute Dr. Shellmer's thoughts to the group of attendees. So I wanted to again thank you so much for participating, and we hope that you got a lot of information from this great webinar. And thank you again, Dr. Shellmer. We appreciate it very much.
Thank you so much for inviting me. I really appreciate the opportunity.
Thank you. Take care, everybody. Thank you again. Bye-bye.
You too. Bye-bye.